Monkey fever is back in the limelight with 2 deaths in Karnataka and 49 cases on the same reported since January 1st, 2024. This has mainly been reported in Uttara Kannada district due to the forest areas. Karnataka Health Ministry has already started holding meetings, and recently Health Minister Dinesh Gundu Rao said that the Indian Council of Medical Research has agreed to develop a new vaccine for monkey fever.
It is already, we have set up our teams there. They have already issued guidelines to see that enough whatever requirement was there in medicines to prevent that has already been supplied free of cost to us, particularly in the 2-3 regions in Uttara Kannada district, Siddhapur, and Shimoga in 2-3 talukas. So there we have focused on more and general awareness, and any treatment that is required, immediately they are being treated, and hopefully it will be under control. And I don't foresee too many. Two people have died, so we want to ensure that nobody else dies. So further prevention of death is the utmost priority for us.
But what is this monkey fever? How can it be prevented? Are there any safety precautions for it? Let us talk to Dr Haleema Yezdani to understand more about monkey fever. She's a general physician with over 2 decades of experience. She's also the Vice President of HIMSS India. Firstly, thank you so much, ma'am, for doing this with us. And now that the monkey fever is, again it has started growing importance and again it's into the limelight. So we want to know more about it. And first, let's begin with understanding what is monkey fever.
Okay. First of all, thank you. Thank you for getting me on board to talk about a very important topic, which definitely is very valuable for people out there who have to get aware to kind of keep away from it. So first and foremost, what is monkey fever? Monkey fever is a viral infection. It's like any other viral infection with some, glitches here and there to kind of diagnose it properly. So it's actually caused by a virus called arbovirus, which is a part of the flavivirus group, okay, and transmitted by something what we call tick. If you say in a colloquial term, something like lice, it's more like a lice kind of a thing, which is an animal body.
It's a parasite, right? Tick. Basically, it's just a parasite.
A very small parasite.
Yeah.
And that's what we call as a tick, okay? And this is found in the lower mammals, like monkey. It's found in the rodents. It is found in the birds. There are a couple of animals which basically are home for such ticks. And that tick acts as a reservoir and a transmitter both. Okay? So once this virus gets infected, the tick catches the virus, it transmits to the mammal which is hosting it. Can it be monkey? It can be some other, or like I told you, rodents.
Yeah.
It can be so many mammals which are basically housing the ticks, right? So they infect them. If any human comes in contact with a monkey or any rat for that matter, can be a touch, can be a urine of the rat, maybe while storage places and all that, then that can be contaminated and spread to the human being. That is what is monkey fever is all about, the origination and the spread. This is what it happens. This is how it happens. So human to human transmission is there, but it is not so common and so rampant as COVID was. The reason being, it is not inhalation induced, not a droplet infection. It is a contact isolation. What do we mean by contact isolation? For example, if the surface is contaminated by, say, the tick which carries the virus of monkey fever, and we go to the same area, we touch the surface, and we use that surface on ourselves. Can be a paper, can be my hand, can be anything. And we contact our mucosal surfaces like eyes, nose, mouth, something which directly has a link to your body. Then we can get infected. And it can be through the saliva, infected person. It can be like any kind of a liquid from the infected person. Can be sweat, can be saliva, can be sputum, can be any secretion from an infected person or human being. Direct transmission, inhalation is not possible.
But it's just because that person has, if the person is affected and if it has used something or it has just kept something there, and in case the other person comes in contact with that again infected item, then
Yeah,
there is a chance of transmission.
then the transmission is quite high. Yeah, that's right. That's right. Direct transmission, if you're handshaking, or if in case you are very in close contact or close proximity, without any droplets on you, it doesn't get infected. I mean, it will not be like a inhalation, or it is not like a, I would say, not like aerosol infection, like how we had in COVID, and which was actually more scary than what this contact transmission is all about. So yes, the transmission from human to human is rare, but does happen. But it's more common from mammals like monkey, birds, and rodents, rats, goose. So transmission from them to human
Animals
is more
to
common.
humans is something that we have
Usually these kind of lower mammals. More than the other animals, it is these kind of lower mammals which basically cause the transmission. And that's why the name monkey fever. Because monkey hosts it more. So that's why, yeah.
And ma'am, what are the symptoms of this in humans? Some of the common.
Well, a very good question, because we have to know to differentiate it. First of all, body pain, which is very severe. Eyes get red, joint inflammation, and the most typical symptoms are GI symptoms. Abdomen cramps, diarrhea, it can be hemorrhagic diarrhea, it can be like black stools, it can be black vomiting. So GI symptoms with a hemorrhagic complication. It's a very, very common form of a symptom of monkey fever.
And how is it different in animals? Like, if there is an animal infected, and of course we might not know it about that. So what can be?
It's very difficult to diagnose in animals, as in the only thing they could respond with is being lethargic or maybe unable to perform the normal activities and all that. So we definitely, without being a veterinarian, I would not go and check a temperature for a monkey or for a bird. So it depends on their, kind of, I would say their normal habitat is changed. Their normal habits are changed. They don't eat well. They become very lethargic. If you have a pet at home who is behaving similarly, then the first thing would be to take them to a vet and get investigated. But for human beings, yes, they have rashes, red rashes, that is hemorrhagic rashes all over the body pain, eyes turn red, severe joint pains, and then the hemorrhage follows. The incubation period or the time before the first symptom is 3 to 8 days. So supposing you have a contact with a monkey or any kind of organism which transmits this, and then you will not get a symptom the next day. It will take at least 3 to 8 days for the things to multiply in your body. And the virus multiplies and then forms the first symptom. That is called the incubation period. The first symptom appears after 3 to 8 days. It could be body pain, it could be general weakness, it could be stiffness in the body, eyes turn red. The second half of the symptom is the GI symptoms, which are very, very, similar to an acute gastroenteritis, but has a lot of complications. There are the severe abdomen cramps, there is frank blood, there is black stool, there is vomiting of blood, vomiting of black color, secretions that could mean altered blood. Hence the name hemorrhagic fever. It is somewhat similar to dengue, but dengue doesn't have this complication so early. But monkey fever does have. Unfortunately, that's the reason why we had 2 deaths. One in Sringeri, and it's more common in the Malnad area and Western Ghats and forest area. And
that's because of the animal part, right? Like
the habitat. Yeah, the habitat of these animals are usually the forest, right? Monkeys don't find unless they are in a thick, planted with trees and thick forest areas. And that's why it's called as KFD, or Casanova forest disease. That's another name for monkey fever. Yeah.
And ma'am, can we know what can be the treatment for this? If someone is infected at initial stage and even in severe stages for both.
Treatment is always symptomatic in any viral infection. Of course, in COVID, we tried so many things. We did remdesivir and all that. But coming out of that, any viral infection for that matter, the treatment started being symptomatic. For fever, we give antipyretics. We give hydration. Very important in monkey fever is hydration. Because, the person gets dehydrated because of severe vomiting, diarrhea, and the severe fever, body pain. Dehydration is profuse. So hydrate the person very well. Early diagnosis is always very important, because hydration, if I tell you to drink water, a normal person can't drink beyond 3 liters.
Yeah.
You feel like vomiting, you feel like puking. So only best way of giving it is IV fluids. So how to start the IV fluids early unless we know what the problem is? If I'm suspecting a monkey fever, I will not wait till the GI complication starts, the patient starts vomiting. The first thing would be hydration. Give proper coverage for your GI, PPI and all that. Give IV if required. Then, of course, keep the fever down at the earliest because the fever spikes are very huge. So control that by giving maybe IV paracetamol. Again, for a simple viral fever, I will not give IV paracetamol. So first test it out. If you have similar symptoms, it should be I would say the clinical acumen should be huge to diagnose that you could be suffering from monkey fever. Get the testing done and then triage the patient for treatment. Treatment is just symptomatic, but early management, IV fluids, IV paracetamol, admission for observation, all this is required, but yeah, early. If done early, I'm sure it's life-saving, shouldn't cause complications. But if diagnosed late, after having black vomiting, black stools, hemorrhagic, then I think things get worse. That's how it is. So yeah.
And what can be the precautionary measures, especially for people closely working with animals, agricultural laborers? Because at least in Bangalore, there are very less chances of people getting diagnosed with monkey fever, but those, and even in general, monkey fever is diagnosed there. So what can be some precautions?
Let's go at Karnataka at large. Bangalore, yes, there are less chances, but Karnataka, we have a lot of chances. We have our Malnad area, we have
Shivamogga,
Shimoga, so highly infested with forests. And so these areas, people have to be safe. How? Wear a glove when you are contacting any animal or treating any animal for that matter. Or if you happen to visit a farm or a forest, protect yourself with proper hand protection. And if you're touching any surface on the contaminated surface or any area or general common area for that matter, hand wash. As I told last time, the best way of washing is soap and water and the regular hand wash method we use for COVID. Very important and life-saving. Even for other people, I usually tell, whenever you're going out, you're in an exposed area, public area, you have surface which is contaminated. You really not know what is the thing which is waiting for you. So be in a hurry, you go just grab your bite of food, start eating. No. See, and some people have that, they carry sanitizer water with them and they just rub. Doesn't help. Take it from me, doesn't help. Because you don't give the time for drying it. They just put it on and done and then start eating. Doesn't help. The most important, the best thing, take a little bit of soap, use some water, rub it nicely and properly hand wash for the time that has been told to you during COVID time and the similar way that the COVID hand wash is done. That is life-saving for in this monkey virus as well. Yes. Because the isolation is contact isolation. That is, the contaminated surface of an infected human should not reach a normal human within a span of time. That's only possible if you wash your hands and maintain your safety.
And same thing if they're coming in touch with animals also, right? Like in case if they've
animal and even humans for that matter. Though human transmission is very rare, but does happen. But does happen. So mask will not protect you much because there's no inhalation there and there's nothing. So the most important protection here is hand washing. Trim your nails. Don't keep very huge and long nails because the more the length of the nails, the more the contamination is.
Now, this basics hygiene precautions that we're talking about at this point.
Very important. At this time, go short on your nails. Don't go kind of. It's a part of this protocol, and I'm sure you would not want to fall sick. And then wash hands after that, because in long nails, what happens? How much ever you wash, the contamination prevails. So that's one thing that you can do. Secondly, hand wash is truly, as much as I can emphasize on hand wash, that is like I have to re-emphasize. It's very important. Then the third is immunity. Work on your immunity. The same thing I told you in COVID. How to do that? There's vitamin C, which is very good source for building up your immunity. Can be natural vitamin C. You don't have to take Limsi all the time. There are people who are taking Limsi for months together after COVID. So I think Limsi, yes, it's an add-on. But you can take more of citrus fruits, the seasonal fruits. They're the best way to increase your immunity levels. Whatever fruits are there for the season, don't forget to have them. Have them in bulk. It is meant to be for the season. And it's meant to be for your immunity for the season. God has given that to improve your immunity in a particular season. I ever thought why oranges come only in winters? People don't eat them because they feel they have the throat pain with that, the citrus food. It gets no. Have them more instead. It prevents you from falling sick. The vitamin C level spikes up with that. So seasonal fruits, have more of vitamin C in your diet, reduce fat intake, take a high fiber diet, some walking, and lot of water. Hydrate yourself very well. So these are the protective measures that you can do at the moment. Of course, again, re-mentioning hand washing, very important.
Basic hygiene skills that ideally
Very
we are
important.
supposed to follow every day. That
Absolutely, but yeah, people forget it because
Yeah.
it's very, it's quite common. Even if I'm busy, maybe if I have patients back to back, I would not think twice before eating. So I think yes, you have to remind ourselves, remind others that yes, hand wash is very important.
Also, there was an old vaccine that was available for this monkey virus, but it cannot be used now. Even the health minister said that. So why is it not effective? Can you walk us through about the problems that it had, and even
What happens in any viral infection is mutation. The mutation or the change of the virus, it is so rapid that we can't come to the core of the virus. Ever thought why HIV doesn't have a vaccine? Same reason. HIV never gave us time. Even now, it has not given us time to form a vaccine. It continuously changes, mutates itself. The same thing with this particular virus. So whatever strain of vaccine we have for the previous monkeypox virus, that is not holding good for this infection because the virus has changed over time. There is mutation. That is a natural course of the virus. Mutation or change is inbuilt in the virus and it keeps happening time and again. Like COVID, we saw there are so many mutations, so many variants. So similarly in monkeypox or monkeypox virus, arbovirus, there is a lot of mutation and hence vaccination is not possible. Very, very difficult to get to catch the correct strain and vaccinate accordingly.
And to keep it, because over time, like virus changes, so
yes, very high time because it keeps changing. Yeah, this is somewhat similar to the transmission of HIV infection as well. HIV doesn't transmit when you handshake or you hug someone, only while deep contact. So the same human to human transmission of monkey virus is only in deep contact. When you have any kind of unprotected events, or when you have a transmission or blood transfusion, or when you have any a needle prick injury from an infected person. So similar transmission, and the similar way the vaccine is not able to perform itself because of mutations.
Yeah, and but the health minister said that ICMR has agreed to develop a new vaccine. So do you think
they're working on it?
Do you think by the time it comes and by the time it's available for the public, all the trial and everything the whole procedure is done, would it be effective? But how long will people be able to?
See, what I would say is vaccines take their own time. For trials, phase 1, phase 2, phase 3, there are rampant things going on. Research is in the background, is definitely in full speed. It has to go on, it will go on. Our health is in our hands. No vaccine will protect you better than your immunity, and nothing can save you than your carefulness or your vigilance. Again, I boil down to the same thing. Wash hands, have a high immune diet, cut down on your carbs, have a disciplined life, sleep on time, eat on time, whatever happens. Work is important, but not more than yourself. Take your break for your lunch, take that break for your snack. It's important to take a time for your water as well. There are applications nowadays which actually reminds you for water intake.
Yeah.
I have one for myself here. It reminds me, it's time for drinking water. Because we are busy. Yeah, it's natural human tendency that whatever we want to do, we don't do. So yeah, that if that helps you, put that application in your phone. All that is more important than vaccination. Vaccination will happen. The research going on. If you're asking me the efficacy, I really can't comment on that. It's too early for that. So let's wait and watch what happens.
Till the vaccine at least comes out, we cannot talk about it. Yeah.
Let the scientists do their work of trial and error. Let them go to the phase 3 trials, come out with the vaccine. I think by then I'm sure the cases should reduce because the human to human transmission is very less.
Yeah,
So
but
when that happens,
every year
the spread is
this
not
happens
random.
though. Like there is,
Yeah, every year
every
there is a
cycle we
season.
see, especially in
Yes,
Karnataka, it
yes,
comes back
yes.
that monkey virus is again here.
Yeah, in Karnataka, it is not in every place.
Yeah.
It's basically in the thickly
It,
populated
yeah,
Malnad,
yes.
that the forest areas, that is where it is seen.
True.
And
Yes.
every year we have this spree and it goes away. So hopefully we're hoping for a surge to come down soon. Meanwhile, very important, you take care of yourself.
The basic
That's important.
hygiene practices and a healthy diet.
Sleep well and very healthy lifestyle. Because the more infections you have out there, the more important to be very, very careful about yourself. The first thing what I always say is don't think about yourself, think about your family. No one would want to say that, okay, for myself, I want to be safe. No, you have people behind you. So just be safe for them. Remind yourself for them. So it's very important to do that. Yeah.
But so, ma'am,
So
to understand more about it, how is this animal to human transmission different and why does it take place? If you could give us a
there
bit
is something
more
called as a
understanding
tick,
about
I
it.
told you, right?
Yeah, the
The tick
parasites.
harbors in that harbors in the monkey's body or the fur of the monkey and the animal. So, the moment you touch it with your naked hand, you don't basically wear any cover or anything. The ticks can come on your hand and start multiplying immediately.
In your body, yeah.
If you have a small cut in your hand, or there could be multiple cuts or abrasions in the hands or fingers. So, if that comes in contact with the tick which is already there in the monkey's surface, then there is no stop. It gets into your body, starts multiplying out there. That's how it happens. If your skin is completely intact, there's no cuts, there's no bruises, there's no space to get inside, then you will not have the transfer from the monkey as well.
Okay.
But if you have a space, even a small cut, a small injury, that is enough. Or if you touch the monkey and touch any of the mucous surface, eyes, nose, and mouth, you can
Mainly
get
face,
infected.
basically.
It's very important. Any viral infection going on, don't touch your face in public unless you are sure you washed your hands well. So, and hands, if there are any cuts or any bleeding, I think the tendency of transmission is very high.
The same
And you
idea.
pet a monkey,
Open wound is there.
or you touch a bird, yeah. Or you touch a bird, or you pet a monkey or something, and you have open wounds in your hand, so the infection is much higher. That's how it is. Even if you just touch and don't do anything, you wash hands, and then you have your food, doesn't happen. The transmission doesn't take place. But yes, if you touch and without hand washing, you touch your mouth and all that, then the risk of transmission is very high. But you touch the monkey, even the infected monkey for that matter, touch the monkey or the bird or whatever is infested, wash your hand thoroughly with all the steps that we have told, clean, dry, and then you have your food or touch your face, doesn't get infected. You'll not have the transfer.
So hand washing is the key over here, avoiding
to cut the chain of infection. Yes, to cut the chain of infection, very important for this. And that's the reason why I was mentioning and re-mentioning about hand wash. So that will be life-saving. Don't wait for the vaccine to come and save you. It will be good.
Thank you so much, ma'am, for doing this. And I think, yes, this is the key message that we can end with it. Basic hygiene and hand washing and a healthy diet can go a long way preventing all the diseases in general and including monkey virus.
Yes. So if you're going to a forest area in the summer, trekking out with your children, be extremely careful. Don't go to thickly, infested or a patch of trees where there's a lot of monkeys. The children usually are very prone to go to such areas with food stuff. So avoid that. So your child should not get infected. It will be really a problem. So take care of yourself and your children, and use the proper hand hygiene to protect yourself. And thank you so much, Akshita, for getting me over. And if you're going on trek, be very safe. Thank you so much.
Thank you, ma'am.